Great. So welcome again. I'm Wolf Kirsten. I'm the co-director of the Global Center for Healthy Workplaces. And I am alongside Tommy Hutchinson, the co-director, and from the UK, and Barry Crisp, our marketing director, also our team from the Global Center for Healthy Workplaces. And could you please mute yourself if that's possible? That would be helpful. Thank you. And today we really want to kind of kick off our 2024 Global Awards program. We want to launch it. It is actually launched. It's open on the website, and we would like to talk about the Global Healthy Workplace Awards, what it's based on, the criteria, and then we have a great case study from Mars Company with Helen Wray from the UK, who won the Global Award in the multinational category last year. So we're really glad about that. We also have Joe Leutzinger on, one of our judges, esteemed judges. We have a few others, I think, on too. I see Alberto, so they can chime in as well. Then we're going to have a good discussion. And of course, we're going to leave plenty of time for discussion and your questions, because we want to make sure that you are comfortable, that you feel you know what it's about, and if you're interested in applying, what you have to do in what time frame. So let me kick it off and share my screen. I think in general, I just want to say a couple rules. As usual, you can put questions into the chat, or we will also, because we're a relatively small group, we can unmute ourselves and use the microphone as well. So I think we'll be good. You should be able to see my screen now. So yeah, here we are. We're open with applications. Deadline is June 7th, and I'm sure you will hear us saying that a couple of times. So let me kick it off. I think most of you know the foundation of the Global Awards. The World Health Organization in Geneva and the HQ back in 2010, around that time, came up or developed with a global group the Global Model for Action for Healthy Workplaces. And this model has been kind of our guiding star throughout. And as you will see and identify within the application, these various 4 areas, I won't go into too much detail here, but I did want to show it to you. I think it's a nice graphic, and it really captures the complexity of the model very well. So it's really, it's from the physical work environment, all your occupational health and safety, to the psychosocial work environment, which has become, it's always been important, but it has become so aware of the companies these days in terms of the working structures and the organization and the work culture. And then, of course, the individual, the personal health resources, what they have and how they can be supported to live healthier and well. And then, of course, the 4th main area, where the enterprise, what role does it play within the community in terms of the health? Obviously, at a minimum, not do any harm to the health of the community, and ideally promote it and advance it throughout. And then the center cycle, continuous improvement cycle, so important. I think we're all familiar with it. Hopefully, we all learned it somewhere along the way in our education. That we need to go through the cycle, and evaluation is so important, and you'll hear Joe talk about it later probably. The judges are look for outcomes of the program, and it's not that prescriptive. It's not like you have to show healthcare costs like in the US, because every country, every system is different, right? So it is a global program, so we need to be aware of that. But there has to be a process shown that there are goals, and companies are working towards certain goals, and they are making progress toward it, that goal or goals, and show the outcomes, show the impact of your programs. That's really important. And of course, leadership engagement at the same time with worker involvement, so important to kind of work on both ends and get the workers involved early on. And our applicants are doing some great work in that area as well. It's really exciting to see the various engagement channels and models, and then the very center, the ethics and values. So our program, or I should say the application, changes every year a little bit, but the core set of questions and those areas what I just showed are the same. But we are very aware of the changes throughout in the kind of rapid changes, pre, post, or pre, during, and post COVID, virtual working, all of those things, AI, so that we cover that. We really try to every year adjust and align the criteria and the questionnaire as best possible without changing the whole model, obviously, because we believe in it. And here's just a summary of pretty much of what I just said, kind of summarizing or capturing it as the 5 keys, as the WHO calls it in the bottom. You know, leadership, commitment, engagement, worker involvement, business ethics and legality, sustainability and integration of the program. Also, that I didn't mention that earlier. That's very important, that you kind of have a long-term view of the program, make it sustainable, and integrate your various units and people working on departments. You know, so typically, like, you know, occupational health and safety on the one side, HR on the other side. That's just one example, but work together. And then, as I said, following the continual improvement cycle. So just very briefly, who can apply? It's a global award, but sometimes people get confused and think, oh, we have to be a global company. No, it's open to all employer organizations. So you can be a small company with 20, 30, 50 employees, and we do have these companies apply, and we have some great examples. So that's our first category listed here: SMEs, less than 500 employees. You know, so we had to draw the line somewhere, right? I know that definitions are different on SMEs depending on where you are, but that's the line. And then large enterprise, anything over 500 employees. And then we have the category multinational enterprises, which we're going to kind of highlight a little bit more today with Mars. Those are the employers which have employees in different countries, and it could be 2, 3 countries, it could be 150, like some companies have. So, and they need to show that they have achieved a certain standard, that employees, whether they're based in pick a country, whether they're based in Kenya or they're based in the US, that they have access to certain programs. You know, not the same access, but, you know, to the overall program. So that's really important, the added dimension, added element for those multinational enterprises to show that they are actually, that program is truly global, and, you know, it's not just in one or 2 or 3 countries. So, and again, Mars will highlight that aspect as well. Yeah, I think okay, yeah, that's what I just basically just mentioned, the multinational category. Yeah, and with that, I think let me stop sharing so Helen can drive her slides. So very glad to welcome Helen. Helen is with Mars, and Helen is the global mental health and energy lead with the global team, right? You work in a global team, and was with us last year presenting in Northampton at the university when we had our global summit. And yes, we're very glad to have her on board and give us a little flavor of what Mars does. So Helen, please go ahead. Thank you.
Yeah, thank you, Wolf. Wolf, can you see my screen? Okay, if the
yes,
slides are great,
we
good.
Can.
Thank you. No, so I am delighted to be with you here today. We were absolutely thrilled to win the award for the multinational company last year. It's been an award that we've had our eyes on for a number of years as we built our strategy and were able to really see the impact that we were having. So, you know, Wolf's words there, that we need to be able to measure our impact. You know, we absolutely agree with that, and we throughout our strategy, we measure everything we do. So how much did we do? What was the quality of what we did, and did it have an impact? Those are sort of the 3 questions that we ask ourselves in all of our interventions. So as Wolf said, I currently have a new role, actually leading our mental health and energy strategy as a key priority for our business as we come out of the COVID world and into the challenges that our associates and their families and the communities in which we're in are facing at the moment. Prior to that, I had a leadership role looking after Europe and deploying our strategy into the countries in Europe. And I've been working in health for my entire career. So I started life as a nurse and then in occupational health in the factory in one of our large manufacturing sites in the UK. So this is a topic dear to my heart in terms of population health and how we shift the health of communities around the globe, and how we do that best through business, where people spend their working lives. So this is Mars. We're still family owned. So the Mars family are very much part of our business. We have 140,000 associates now worldwide, in many, many countries, so more than 70 markets. We have some very large sites. So the site that I'm sitting on today is a large manufacturing site with over 1,100 associates on, but we have small little office sites and smaller manufacturing sites with less than 100 associates, and we also now have a large veterinary business around the globe, so more than 3,000 veterinary hospitals. So we're diverse from manufacturing, retail, and our veterinary hospitals. Many associates working 24/7, so rotating shifts, as well as our field sales, our R&D, and our office workers. So a diverse population that we need to impact with our strategies. Mars has a number of different brands. So the ones that most people are aware of are our confectionery brands, so our sort of chocolate, but also a large pet care business, and a large food and nutrition business alongside the vet health. And we are all behind a Mars purpose, which you can see in the top left there. The world we want tomorrow starts with how we do business today, and you'll see that coming through the work that we do. So we sit in this element of that Mars purpose. In the world we want tomorrow, everyone is thriving. So that's where health and wellbeing sits. We are a centrally driven function. So we sit as a COE, so a centre of excellence in the centre of our businesses. We develop the global strategy, which then we deploy locally. So we call it glocal. So a small centre, we look at population health and population health trends. We look at safety and environment, and we decide on the key programs, and then those are deployed by our teams around the globe. We've got lots of data that shows some concerning health trends across the globe, not just our own organisation. So many of you might have seen the recent McKinsey study in 29 countries, where more than a third of respondents report exhaustion and lack of energy. And internally, we know that really matters. We're able to track energy against safety incidents, quality incidents, attrition rates, productivity, as well as short-term absence. So energy really matters. So if our associates are not feeling energized at work, that has a business impact for us. And obviously it matters not just for our business, but for them, their families and their communities. So we know that as well in our own internal data, that our associates, when we ask them in our Mars Experience survey, the energy is often the lowest, one of the lowest performing results or data points that we have through that survey. And I'll talk a little bit more to that a bit later on. So this is our strategy from health and wellbeing. So you can see, our ambition is to create a culture of health, safety, and energy where everyone is thriving. And we have three pillars, or three strategic pillars, to help us deliver on that: impact, integrate, and ignite. And through that, in impact, our key focus there is on mental wellbeing and energy management. But it's all very well to develop these great programs in the centre. If nobody knows about them, they go nowhere. They just stay as great programs. So integrate is our second pillar, which is about how do we make sure that we get our programs into ways of working, processes, policies, our segment business plans and people strategies. So we're very much about how do we business partner in order to ensure that our programs get down to our associates and populations around our business. And then ignite is about how do we inspire behavior change? How do we catalyze a social movement that really creates health? So how do we help our associates understand what we mean by health at Mars? And then coming back to the WHO model, you can see here that we absolutely believe that in order to do that, the success is not actually about the health programs. It's not determined by the activity set, how many stop smoking, sort of programs we have, but it's rather through how those commitments through leadership capabilities, the environment and the processes behind that support what we want to do. So under the sort of ethics and values area, Mars is a very principled business. So we all line up behind our 5 principles of mutuality, responsibility, the 2 that are mainly focused here. You know, that we have a sort of mutual responsibility in our business to create a great working environment for our associates. There is a generation sustainability plan that you're able to look at on our external website. There are ethics and compliance policies, so we do audit our sites against those and against human rights, and a supply chain code of conduct. So that's, you know, very integrated into our business. We recognise our leaders are our you know, greatest asset, and you know, if your leader is healthy and well, that has a big impact on the teams and the associates that work with them. But we also have these sort of global commitments to HSE, to mental health, diversity and inclusion. So you'll be able to read our mental health commitment on our external website if you'd like to see that. And then we have the sort of data to back up how we're tracking against that commitment. And then finally, worker involvement is important. You know, our associates we need to listen to them, we need to understand what their pain points are, and we need to deliver solutions that are co-created and address the areas that are important to them. So we spend a lot of time with our workers and worker involvement groups to understand how we can pilot and how we can you know, create great solutions that will address the problems that they're facing. The World Health Organization has this sort of, you know, obviously, as you know, this large model, and we've tracked, you know, at what we do to each of those models. And I'm just going to pull into the evaluate and come back to that again. You know, it's so important for us that we have results-based accountability. So we will look at the population that we've impacted or that we've, you know, had a program with, and we'll ask these 3 questions, and we have a role within our team that analyzes all of our data. So how much did we do? So did we reach people? How well did we do it? What was the satisfaction of a program that we delivered? And is anyone better off as a result of it? So have we seen the shift that we hope to see? And if we don't, then we pivot and we stop that program and you know, go back and think again. So that's really what we're doing. And then in creating safe and healthy physical work environments, a couple of areas there. So, you know, do no harm risk management is really important to us. You know, we have a view that all incidents are preventable. We have occupational health and safety management systems that identify and manage the risk in our businesses. I'm sure many of you do as well. But we also look at things, you know, to understand, you know, where are key risks across the globe, not just in manufacturing, but in our supply sites as well. So two-wheeled transport is an area at the moment that we're really looking at in terms of how do we, you know, improve the risk for our associates in field sales roles that are out on motorbikes in some of our developing countries, you know, sort of, you know, delivering product and selling. So, you know, we absolutely look at safety and take that sort of ISO approach to safety. And then I guess the thing that sets us apart actually is our Healthy Worksite program. So we have articulated 10 site health fundamentals that we want all of our sites to drive towards, and you'll see the categories here. So looking at facility design, rest areas in our factories, but also, you know, sit-stand desks and focus areas in our offices where people are wired to, you know, multiple calls on a desk in our sort of open office environment that we enjoy in Mars. Support for physical activity, support for nutrition. So do we offer good food at all hours of operation? So we make the healthy choice the easier choice for our associates. Do we support energy management and recovery? So we have these 10 fundamentals, and we have a set of criteria. All of our sites with more than 100 associates are required to take part in this survey every 2 years. and then to build an action plan for improvement. We're about to come into a 2024 cycle at the moment, but in 2023, we made good progress with 78% of our sites now at gold or above. We have a new platinum level for our sites that are really, really going for it with their environments this year, because people have said, oh, we've got gold, how do we go further? What are some more things that we can do that are really cutting edge, evidence-based environments of health, safety, and energy? And so that programme is really well taken up. Many of our sites under 100 also take part, and we report that out externally as well, so you can see our progress there. So we're really proud of that and how well that's been sort of accepted and taken up by our sites, and how that's driving improvement and better environments for our associates to work in. We also think about it not just on the physical working environment. We've got many people working from home, working on the field, working in retail, in veterinary hospitals. So it's not just about a site-based survey. It's broader when you read the questions. It's much more about your experience of the environment in which you work at for Mars. And then finally, in this section, our positive psychosocial environments. So this is our framework for how we're going to create better work environments. There's an action plan behind each of these protect, promote and provide goals. Here you can see some of the things that we see as important in those areas. We've used the One Mind at Work mental health index to help us to focus and prioritise using evidence-based practice. And mental health and energy is an absolute priority area for us at the moment. We know when people aren't feeling well, as I said before, it's linked to attrition, it's linked to quality and health and safety incidents, and we see absence and lower productivity. So we have a number of strategies behind this at the moment to really double down and ensure that we create really good psychosocial work environments for our associates to operate in. And not just looking at delivering stress management programs. Much of it is that this me, we and us. How do we make sure that we protect our associates in the workplaces that are in, looking at organisational level interventions, looking at team interventions, how teams together can problem solve and make things better through impact planning, and then individually, some of the key capabilities that we want to build for them. Right. So we invest in our culture and our line managers and teams, and I think our line managers are really, as I said, key to us. They are a predictor of associate energy and health. So we know that when our line managers are feeling well, our associates are feeling well in the main. And you can see that when line managers are supporting our programs, we get a much better uptake rate. So this graph on the right is about sort of the penetration rate of some of our programs, depending on the line manager's capability. And so we talk to our line managers about 3 leadership behaviours that train them in leadership behaviours of advocacy, role modelling and permission. So in our leadership training programs, there's a program there that really delivers on that. So what do we want you to do? When we went out to our line managers at the beginning of the strategy, they said, just tell us what you want us to do. So those are the behaviours that we've asked them. Give people permission, talk loudly about health and wellbeing, advocate for it, and role model it yourself, importantly, because if you don't role model taking recovery space and time, if you're online when you're on holiday, that's what the rest of the team will do. So line managers are key, and we have, as I said, programs in our Mars University on that, and then our Mars Associate Survey, which is all about associate experience, goes out to our associates every year. We get 90% participation in that, so we get the most fantastic data back from our associates around these areas of engaged, energized, included and empowered. And we ask every team then to do an impact plan based on their results and their data, to follow through on that. And what we see is that follow through is important. So when associates have a really great impact plan in the system and they follow through on it, you see that they either maintain or they improve their results in the following year. So we absolutely understand that energy is the property of the team, but also the associate experience is the property of the team, and that we can impact that by making sure that our teams are really focused on improving their own experience with the things within their control, and they push up anything that's not within their control to the organizational level. So from there, those I didn't realize, so I'm sorry, I didn't realize this slide built in quite the same way. So there's your arrow of the advocacy, role modeling and permission that really increases up the penetration of our programs. And then here, this is you know, our model. So when we talk about Ignite and the associate experience, our framework of health is here. We call it our Be Well Together model. We only launched this probably nearly 2 years ago now. I think traditionally what you see is components model of health, so like the Gallup 5, so you know, mental well-being, physical well-being, social, financial, career well-being. We spent quite a period of time working with our associates and asking them what well-being meant to them in our site, and in the end we came through with this more behavioral model. So what do we want people to do? We want you to energize your day. We want you to take those actions that immediately improve your energy and well-being on a day-to-day basis. And then we want you to boost your health. So what are the actions that build long-term physical, mental and financial health and safety? But without being too prescriptive about what those mean for an associate. So, you know, we wanted to meet associates at their door and not talk to them about, you know, lots of health interventions. We wanted to help people understand their own health status and what would be important to them. And then at the bottom of there, live your purpose. So we know that purpose is the intrinsic motivator of health. And if we can help people to really understand what their purpose is, how that links to their job and their role and their lives, then we can help people to think more about some of the, you know, the more challenging things that we all need to do to improve our health. So that's our model. And in the middle is Be Well Together, because the one thing we absolutely know is that health is social. So Be Well Together is all about how do we do this together? How do we create a social movement of health that enables our associates to be the best that they can be, to live their purpose, to have days that are full of energy and a long-term health plan that ensures that, you know, when we all hang up our boots at the end of our working careers, you know, they're still healthy and well for their families, their friends and their communities after that. So that's the framework that you'll see around the business and behind me today, that we hang all of our health programs on. And our local teams find that really helpful, because they can look at their own business environment, the challenges that they have in their own country or their own site, and they can then build their plan for the year based around these 3 areas. So we're not prescriptive from the centre. We really allow our teams to really think about what's important for them. And some of the areas here that you'll see are some of the things that we do more globally, but it's, as I said, it's local again. So finally, and then, you know, in that enterprise community section of the model, our sustainability plan is really important to us. So we are committed to helping create safety, health and sustainable worlds for our partners and communities in which we operate. And so there are 3 areas that you'll see: healthy planet, thriving people and nourishing well-being, that we report out on as well each year. So healthy planet is all about climate action, net zero, rethinking our packaging. Thriving people is about working with our supply chain to think about how do we support there, so full potential for women in our farms around the globe. And then nourishing wellbeing looks very much at our workplaces, so that's where our health and wellbeing strategy sits, is in nourishing wellbeing. So that's that. And then here's some of the examples of some of our site wellbeing programs for 2023. So there are lots of examples, and we could go into any country and we could look at their plan and look at what they've been doing, and give you some more data about some of those programs. But as I said, it's not so much about the programs for us, it's about those sort of the things that surround the programs in the centre. But there are many programs that our associates are running, and there's a few here. So mental health first aiders, we have champions around the globe. We're building more of those to make sure that we have peer associates that are able to talk about mental health and destigmatizing that around the globe. So we're just about to launch our mental health first aiders in the MEA region, which is new. We already have them in many of our developed markets. We have some lots of resources in our mental health resources about how are you and critical incident support, so need it now, just in time tools for our line managers to pull from if they're worried about someone. We have an Energy for Life program that is our flagship program for building capability in energy, which we get great evidence from in terms of how people are able to build new behaviours, particularly in daily recovery and mental focus, and sustain those now for more than a year. So we see that as a really big bet for us. And then we have a global associate assistance program offering. It's not one company, because what we've realised is there is no one company, but all of our sites, our associates have access to those safety net support services that are provided in EAP, and we're able to use that. And we have a standard set of global metrics now with our 5 biggest providers to make sure that we're getting the same data from all of those providers, because what we found is it was very diverse in terms of the data they gave us. So that's now enabling us to really see where we're using our programs and where we need to do more communications and more education for our associates, particularly in some countries where these are quite new. So lots of programs there that are central and some that are local that we're deploying. And so finally, evaluation then, we absolutely, as I've already said, evaluation is really important to us to be able to show the value of the investment as well as the return on investment, and to really show that we are delivering against our purpose, which is, in the world we want tomorrow, everyone is thriving. And that's really the end of what I have to say. I think I've just about hit the 20 minutes, I hope, Wolf, but very happy to speak to anyone to tell you a little bit more about some of the things that we are doing. Thank you.
Thank you so much, Helen. That was excellent. That was really good. As you can imagine, not easy to summarize in 20 minutes. So by the way, I'll speak about that a little bit more later, but the finalists, we have 2 finalists per category. Most of you know, I think they have to present at the Global Summit, and they only get 20 minutes. So it's to kind of present the entire program, and then there's some questions. So it's for sure not that easy, but I think you did a great job also last year in Northampton. So thank you so much for that. And we are open for questions for Helen before we engage with Joe. And I already see a hand up. It's Tommy. Tommy, you want to go ahead? You're still on mute, I think. Yeah.
Sorry. Hi, Helen. That was really
Hi.
inspiring to hear you present again. And you got such a fantastic program. And I don't think I'm too much off the record by saying your program was perhaps one of the very best we've ever had presenting at our summits. So maybe Joe can add something on that nature. But it's and I suppose what really interesting about your program is also, I find, is the way you've localized it. So depending on the results, the teams make their own direction. I think that's really interesting. I've got 2 questions, if I may. And really, at the end, you were referring to research return on investment. And do you have any? I mean, does everybody in your company buy into this? I'm talking really about the leadership, or do you still have people who perhaps see that this as a distraction in terms of financial costs to do these programs. So that's probably my first question. And how do you deal with that if you do have that problem? Because I think many people would be interested to know what language and how we persuade people. And the second is, there are lots of new innovations in the field of workplace health, probably especially since COVID and so on. And one of them is in the area of obesity. There's a new drug out by Novo Nordisk. I think it's called GLP-1. And is there is there a medical scientific answer to some of these problems? What's Mars's kind of approach to a new innovation such as an obesity drug or something like that?
Okay, fine. So I can take the first one. So, do our leaders believe this is a distraction on cost? I'm sure there are some leaders that believe that, of course, because we have the full range of the human experience in our business. I think one of the biggest areas that is helping us to shift that is our Mars Experience Survey that we run each year, that really now tracks the business case of why energy and health matter for our business, and how that is linked to attrition, productivity, quality incidents, which cost an extraordinary amount of money, health and safety incidents, and short-term absence. So that decision that we make in the morning, am I fit for work? Of course, we don't want people dragging themselves in that are not fit for work or who are infectious. But we all know that sometimes if you're not feeling energized at work, you will make a decision not to go to work more quickly than another, particularly in the work from home thing. So we know those things are linked. So that gives us a very good, robust business argument for why health is important in our business. And then the other thing that you need to do is then map the interventions that you want to introduce and how that will help those costs, rather than so that's where our team comes in as a team of specialists, is identifying the evidence-based interventions that will help that. So we don't have a scattergun approach of expensive activities that actually don't make the difference. They don't have that sustainable change that you're looking for in the programs that we do. And I think the fruity Fridays and the yoga on a Tuesday afternoon, whilst those are great engagement activities, and I love a bit of that, do they have sustainable business behavior change? Do they impact the highest risk groups of your business and change the behavior there? Possibly not. So what we're about is looking about how do we focus in and support those associates, the more harder to reach associates, where we know that there's the biggest risk and the biggest impact of change, not for them and their families and their communities. So I think the associate survey has really given us the most fantastic set of data to help us track that and to make those moves. Of course, there'll always be people there, so you need to make sure that you've got a really good, robust business case of why this is important and why the activities are going to make a difference. And then to your second question on obesity and the new drug, we see health. We don't target obesity in that way. So in our energy management programs, we really focus on helping people to make the small changes that will make a big difference for them. I think we've moved away from some of that, sort of prescriptive health education, because if that worked, it would have worked by now, wouldn't it? We've all had health education at us for many years. People know this stuff. What we want to do is close the knowing doing gap. So how do we help people and educate where needed, but knowing that there's so much information around about health now? How our objective is, how do we close the knowing doing gap? And we believe that that actually understanding your purpose and the why you might want to change, using sort of a behavior change model, so like the theory of planned behavior, sort of helps people to understand more about the why and moving that intention to change without the use for medications. So we're not suggesting that everyone goes out and gets tablets. More so, there's great technology as well, isn't there, where you can check your heart rate variability. Nor are we providing everyone with a smartwatch to be able to do that. We talk to those things and we help people understand those things, but we aim to meet people at their door and help them to get that knowing doing gap piece sorted and make small changes that gradually over time will increment and ensure that they're able to have healthier lives. Does that answer your question?
Yep.
Mm-hmm.
Completely, really comprehensive. Thank you very much.
Just a quick follow-up, Helen, on that last point. That totally makes sense. Are you actually receiving inquiries or interest level from people who are obese, who maybe want interest in asking, can you help us or cover the drug, or especially in the US? Because I know it's
I don't
pretty,
know about the US, so I couldn't speak to the US.
Yeah.
I haven't heard anything about it though in the channels that I'm in, said that this is something that people have been, that we're needing to spend a lot of money on. But I can find that question out for you, but it's not something that we're looking at in our team.
Thanks. Yeah, no problem. Thanks a lot. We have a question here from Alberto. He's asking about KPIs and outcomes. I know you mentioned them. Can you mention an example, the ones that you actually share with your stakeholders in addition to process? Yeah. Yeah.
So we have a wellbeing data hub that shows our data in terms of clear KPIs. We've moved a little bit away from having 3 big hitting KPIs that we had in the early days of the program because of the global nature of our business. It didn't land everywhere, so you can't measure health outcome in much of Europe, whereas you can in the US. So we've now moved to a much more sort of comprehensive data hub that allows our teams to pull down data where we have it. So the things that we have are, associate assistance program information that we have globally. We have our Mars Associate Survey that we have globally, and we have our site health fundamentals that are available globally. And we're just looking to add in some more of our local data on absence and healthcare costs actually in the US that allows then a site to track their own data and decide on their own local targets that are more meaningful than these sort of big, sort of way up here targets. The only one that we really still retain is our site health fundamental, our ambition to ensure that our sites make it easy for our associates to make a healthier choice.
Thank you. No, excellent. That's a good answer. Let me ask one last question before I move to Joe. Coming back to the actual awards process. Anything on your behalf that you would mention, that first of all that you would maybe recommend or for other applicants that you think they should do, or any kind of or something that was very challenging, or go ahead. Yeah.
I think leave plenty of time because it is very comprehensive, and you do need to speak to many different stakeholders and parts of the business in order to be able to complete the application. So I think that would be for me, is make sure that you really understand what the questions are asking you, and that you go out and you seek that information from the different parties, because it was more than just our health team. It was our safety teams. It was our sustainability. There were all sorts of teams that we needed to make sure that we had good, correct, up-to-date data and information from. But it was a great exercise in pulling all of those elements together from our perspective, and made us really think about these different interactions beyond where we were thinking at that point. So just doing the application is an education in itself.
Great. Thank you, Helen, for that word. So this is a perfect segue to come to Joe, and I think you should see my screen again. So these are our 5 judges, just for those of you who don't know yet. Evelyn Cottom in Europe, Alberto Ogata in Brazil, South America. Then we have Edith, I think she's on the call. Hi, Edith, from Edith Clark from Ghana, and Tracy Colby-Alexander in Australia. So we're really covering the globe here, as you can see. Hi. With all the continent, or most continents. And then I should mention Joe, that last but not least, Joe Leutzinger from Headversity in the US. So Joe, let me bring you in here. You are one of the, excuse me. Yeah, Joe, can you hear me?
Yeah.
Sorry, I think it was Edith. Joe, I just bring you in here. So thanks, first of all, for taking the time and joining us. I just want you to give maybe a quick perspective, your take as a judge. You've been with us for a while. You've seen the evaluations. You've done the work. And what do you think what is really important? I just, we have your 5 points, but I'm sure you have more color commentary on this for potential applicants.
Well, thanks, Wolf, and hello, everyone. I know we're from all over different time zones, and just want to recognize what a great case study we just heard from Helen and her colleagues at Mars. So really enjoyed that, and it was a great reminder of the great program that you all do there. There's several benefits to applying. 2 I want to highlight, and one was related to what Wolf just said recently, and that is you really get input from a wide variety of people around the world. So we give you summary of input for your application, and it's really a collection of all the input from all the judges. And then the other thing that I want to recognize as a benefit is that the Global Center, while we're talking about the awards today, they also have a certification program, which to be certified through the Global Center can really help you internally with the credibility of your program. So by completing the application, you're on your way to also being certified by the Global Center. The other thing I want to point out, and I'm sure Helen can relate to this, is that when you go through this application, it really helps you reflect on your current program and what you're currently doing and where you want to go. And then the other thing that's is so unique to the Global Center is whether you're in the small, large, or multinational, you're being compared to organizations and companies around the world. So when you apply as a small, medium-sized organization from Kansas City, for example, you're being compared to those in Europe, those in Africa, those in Australia, those in India, which really gives you some great insight into how you compare and what some other things you can look at, not to become too domestic focused, that you can draw from learning about those other programs. We know that, I'm sure Helen can attest to this, that getting started is the hardest part of applying. So that was great advice to start early. So the sooner you start, and once you get into it, I've done a number of these when in my other roles, once you get into it, you really want to finish it. It becomes kind of a pride, and almost like you're writing a book or writing a historical statement on the work that you've been doing, you and your colleagues. So getting started, if you're putting that off, I would highly encourage you just to look at the first question, look at the second question, and just move yourself to get started. One of the things that I know has been done a number of times by organizations is there's many departments within an organization that uses external recognition to benchmark their department. And that's what we're doing here for health and safety. So making that known among your senior leaders that we're doing an external recognition, external benchmark, whether you are a finalist or not, you can still get good recognition from your company of going through that process. And then Wolf mentioned about the 5 points. And the one that is very dear to me, and I think my colleagues, judges, is that the comment Wolf made as we go through the application every year and make changes to it, we're very conscious of not asking the same question twice. So if you find yourself saying, well, I answered that in section 2, I'm just going to repeat it here in section 4, you're probably not understanding the question, because we never look for repeat information. And then the other thing that I just want to wrap up with is when you talk about evaluation, some of the things we look at is participation, behavior change. Helen did a great job of laying out some of the things they look at. But one of the things that's really important, and I think that can help you internally and externally, is what's important to you and your organization, and how are you tying those health and safety outcomes to the overall business strategy of the company. And we've had some great examples over the years of it being very industry and very company specific in terms of the evaluation data they were gathering and how that helped the overall business. So it doesn't have to be, in the US, we get too focused on healthcare costs and even absenteeism, recruitment, retention. All those things are good, but also thinking about how it fits into the current business. And then I just want to end by just calling out my fellow judges. It's such a great team to work with. Wolf, Tommy, and Barry have done a great job of keeping this program going and putting together a assembly of judges that's just tremendous to work with.
Wolf, you're on mute, I believe.
Yeah, same old mistake. Thanks, Barry. Thanks, Joe. Really appreciate the summary, and thanks for all your hard work. I know sometimes it's not that easy getting through the applications every year. And we get, by the way, we get some great applications. I mean, from all over the world. And I think 2 years ago we had our first winner from Africa, from Kenya. So that was great as a small, medium-sized enterprise. So keep them coming. So that's really, really helpful. Just wanted to kind of close I know we have a few minutes left, and then maybe we have a time for a question or two. I won't go through all of these, but we have some basic requirements. It's kind of obvious by now, I think, but it's really an employer award. Which, with that I mean, like sometimes we get vendors coming to us and saying we have a great platform or whatever, and maybe it's part of a whole program, but it's about for your own employees, obviously. And we do, I should point out, we do offer or actually go through a fairly robust profiling program in terms of over the course of the year. So in terms of if you are a winner, or we also invite some of our finalists for some of our events, you get a chance to share your story with the world. And besides social media and the website and newsletters, what we do periodically, we have those events as well. So I think that's really important and a good feature of the awards. And then I should mention the last point here that we do ask our finalists to come to the awards summit. We are, of course, now back in person since last year, and this year we will be in Brazil in November. So we're really excited about that and working with our Brazilian colleagues. We'll be actually in the capital this year in Brasilia, and have some really good support there. So very excited about that. I do wanted to mention, as Joe referenced, our certification program. Just quickly, the big difference to the awards program is that you actually get a fairly substantial feedback report, a benchmarking analysis based on the global standard with all the data that we get over 12 years. So that's really the advantage. And as Joe said, the feedback you get from the awards is I don't say minimal, but because obviously the awards program is free, and there's some real work behind that to produce that kind of report. And as you can see, that we have the links listed there if you want to take a look at that. And then finally, in the summary here, June 7th is the date for closing. So as Helen mentioned, that there's a time element here, and I think those companies who kind of already have their data well organized and have those communication channels open with some of the other departments, they're kind of at an advantage, right? Because then you can pull it together quicker, or they may have applied for a local award, as many of our companies have, and they come to us because they won the Brazil award in Brazil, or in India, or in Australia. So that's always exciting to see. And the dates for the summit are now set. It's November 5 to 7, just so you know that. And we announce our finalists in July. So let me stop sharing and open it up again to the group, or maybe first give either Tommy or Barry a chance. Do you want to? Did I forget anything? Do you want to add anything? Any motivational comments? Just kidding.
No, I think you've pretty much covered everything, particularly between the wards and the certification. Like you said, with the certification, it's all about knowing that you've reached the benchmark and the criteria to show that you have a great workplace health program, whereas the wards is to see which of those programs are the best of the best, essentially. And that's just like, yeah, another clear distinction between the two. But yeah, I think you've covered everything, so thank you.
Thanks, Barry.
Yeah. And I would definitely, the way Joe and Helen described it, about almost like writing a book and feeling you've completed something that you can actually use, whether, you know, in addition to submitting, it's actually a useful tool to have gone through the process. And I thought that was really interesting to hear from both Helen and Joe.
Edith, did you want to chime in? Not that you have to, but I think you mentioned you were trying to say something earlier. If go ahead and unmute yourself, but just wanted to see if there's anything you wanted to say. Or Alberto, I know Alberto, you chimed in already on the chat with some really good questions, as you always have. But you don't, feel free to chime in. We have a couple more minutes. That's fine too. I just wanted to maybe say one or two things at the end here. One of the things, Helen, what I liked about Mars and Gary interacting, you guys were very communicative. So you ask questions, and especially with a multinational category, it's not always that easy because you asked, well, should we list all of our examples in all these countries? Should we only list one country? Should we make a global statement? So that was really helpful for us, and I'm sure for you with our feedback to get that application right. And as Joe was saying, we don't want duplicate information in all these questions. We do get that, and that drives the judges crazy, if you know what I mean. So the communication, we're open. We have open channels, so you can communicate with me, Barry, or Tommy, info@globalhealthyworkplace.org. The link was in the slides, and it's on our website everywhere. So feel free to reach out to us. We respond pretty timely. So I think that will help your application when you're at the stage. All right, I think if there's not any other comments, I'd like to thank for your attention, for being with us, and you'll hear from us, I'm sure, and hopefully we'll hear from you. So good luck with the applications, and talk soon. Bye-bye. Thank you, Helen, again. Thanks a lot.